Chronic intoxication with aromatic hydrocarbons, benzene. Definition: intoxication with aromatic hydrocarbons, benzene and its homologues, xylene, toluene, styrene, is a conditionally professional intoxication that develops as a result of industrial contact with them, characterized by damage to the hematopoiesis, nervous, cardiovascular, digestive, and endocrine systems, the development of neoplastic diseases, and the polymorphism of the clinical picture. Production: paint and varnish, plastics production, synthetic rubber, nylon, insecticides, medicines, construction, repair, and painting works. Pathogenesis: the concentration of benzene in the bone marrow. Impaired karyogenesis of young bone marrow granulocytes. The appearance of malformed nuclei in metaphase. The number of stem cells, their proliferation and differentiation decreases, and indirectly through a decrease in the content of vitamins B1 and B12. Benzene interferes with the process of lipid peroxidation, DNA synthesis, oxidative phosphorylation, which leads to a defect in production and a reduction in the survival of blood cells. Clinic of benzene intoxication. Acute benzene intoxication. First, light intoxication, light euphoria, general weakness, dizziness, noise in ears, headache, nausea, vomiting, unsteady gait. Outcome: the clinic disappears within a few hours. Second, medium degree. All symptoms plus vomiting, convulsions, bleeding from the nose, gums, uterine bleeding. There are signs of organic brain damage. Nystagmus, tremor of the eyelids, fingers, increased tendon reflexes, asthenoneurotic syndrome. After 3-4 days of treatment, complete regression of symptoms, but in 20% of cases, residual effects persist in the form of asthenic and asthenovegetative syndromes. Third, 3rd degree, the development of coma, tonic and clonic convulsions, decreased tendon reflexes, the presence of pathological reflex, inhibition of the reaction of pupils to light, involuntary urination and defecation. In the absence of treatment, death in 3–5 minutes, paralysis of the respiratory center. Complications: toxic hepatitis with the development of chronic liver failure, chronic renal failure. Treatment: remove the person from the danger zone. Washing of mucous membranes and skin with water. Keep the person calm, warm. Gastric lavage, throat probe. Saline, laxative. Forced diuresis. In 30% sodium thiosulfate, 200 milliliters oxygen inhalation. Symptomatic therapy: vitamins B1, B6, B12, ascorbic acid. Chronic intoxication. It develops as a result of repeated long-term inhalation of vapors for 3–5 years, or with its systematic contact with the skin in conditions of exceeding the MPC of benzene 5 mg fraction M3. Bone marrow hematopoiesis is primarily affected. Damage to the nervous system develops against the backgrounds of hematological disorders. Develops slowly. Complaints about general malaise, fatigue, headache, dizziness, disturbed sleep rhythm, increased irritability. In some cases, at the same time, pain in the epigastric region, dyspeptic disorders, loss of appetite, hairburn, nausea, sometimes vomiting. Hematological disorders: leukopenia, thrombocytopenia, aplastic anemia. The hypoplastic process in the bone marrow is manifested by bleeding, increasing weakness, dizziness, noise in the head, palpitations, aching, pain in the tubular bones. Hemorrhagic syndrome. It is represented by bleeding gums, nasal and uterine bleeding, spontaneous bruises on the skin, small pain-state hemorrhages. Positive symptoms of tourniquet and pinching. Damage to the nervous system during benzene intoxication in the stage of functional metabolic reversible changes manifests itself in the form of asthenic, asthenovegetative, or asthenoneurotic syndromes. In the second stage of benzene intoxication, syndromes are observed: polyneurotic funicular myellosis syndrome or toxic encephalopathy. Polyneurotic syndrome. Patients complain of mild pain and weakness in the arms and legs, There is muscular hypertrophy, pain on palpation of the nerve trunks, hypoesthesia in the distal extremities, cyanosis, and a decrease in skin temperature. In the distal extremities, increased sweating of the hands and feet, weakened pulsation of peripheral vessels, cramps in the calf and other muscles. Funicular myellosis syndrome. Weakness, pain in the legs, but lack of coordination, decreased deep muscular sensitivity. The syndrome of toxic encephalopathy is accompanied by microorganic symptoms, with extrapyramidal hyperkinesis. Mental disorder occurs. Liver damage is manifested by the development of fatty degeneration. In several cases, cirrhosis of the liver is possible. According to the severity of chronic benzene intoxication, mild degree develops slowly. However, in the blood, the initial manifestations of the disease. Persistent decrease in leukocytes, less than 4 on 10 fraction 1 relative lymphocytosis, astheno-vegetative syndrome, initial manifestations of vegetosensory polyneuropathy. Average degree reduction of leukocytes less than 3 on 10 in 9 fraction 1 neutrophils with toxic granularity. A decrease in platelets below 180,000, mild anemia, an increase in ESR to 25-30 mm fraction H. Severe astheno-vegetative syndrome, hemorrhagic syndrome, petechia on the skin, bleeding gums, heavy and prolonged menstruation, vegetosensory polyneuropathy, cardiovascular failure, hypotension, pulse lability, dystrophic changes in the myocardium. Severe degree funicular myellosis with a decrease in deep sensitivity and reflexes on the lower extremities, signs of encephalomalacia, impaired liver function. In the blood, leukocytopenia 2.0, 0.7 on 10 in 9 fraction 1. Neutropenia, relative lymphocytosis, thrombocytopenia 50-30 on 10 in 9 fraction 1 and smaller. Hypochromic anemia, elevated ESR 50-70 milliliters fraction H. A typical variance of benzene intoxication. Option 1. The initial predominance of the syndrome of hypopulsitic anemia with unchanged thrombocytopenia. Option 2. thrombocytopenia without violation of leukocyte and erythrocyte sprouts may lead to secondary posthemorrhagic anemia. Option 3. Benign leukemia, acute and chronic. They develop with an experience of 5-10 years or a few years after cessation of contact with benzene. Treatment. First, etiological treatment. Termination of contact. Second, pathogenetic treatment includes agents that stimulate hematopoiesis, vitamin therapy B1, B2, B6, B12, C, P, biogenic stimulants, adaptogens with damage to the nervous system, agents that selectively improve cerebral blood flow, metabolites of nervous tissue for liver damage, hepatoprotectors. Periodic medical examinations of workers involved in the production and use of benzene, including laboratory work, are carried out once a year. In the production and use of homologies and derivatives of benzene, isopropylbenzene, styrene, toluene, etc. one time in 24-hour months. Participating in preventing medical examinations, neurologist, dermatovenerologist, otorhinolaryngologist, ophthalmologist, urologist, oncologist. Surveys. Erythrocytes with basophilic granularity, bilirubin, ALT, AST. Working capacity examination. Patients with chronic intoxication are not suitable for professional use, need employment, and % disability. Thank you for your